The word pharmacology is derived from two words. First we have pharmakon, which means drug, and the other word is ology, which means to study. So if we combine these two words, pharmacology refers to the study of the drugs or the science of the drugs. Now the domain of pharmacology is very vast, but vastly we can describe it into two domains. First of all, we have pharmacokinetics. On the other hand, we have pharmacodynamics. So what is pharmacokinetics? Pharmacokinetics, in its literal meaning, it comes from two words. Pharmakon means drug and kinetics means movement. So pharmacokinetic refers to the movement of the drug in the body. In other casual words, it can also be described as what body does to the drug or what happens to the drug when it enters the body. Generally, it is characterized into four phenomena whenever a drug enters into the body. First is absorption, second is distribution, third is metabolism, fourth is excretion. If we take a look at this diagram that shows us the four phases of the pharmacokinetics or the movement of the drug into the body, so we can see that if we are administrating a medicine into the body through any route, first of all it has to be absorbed. Then only then it can perform its action in the body. So after its absorption, it is distributed. Distributed where? To the tissues where it's going to perform its action. After performing its action, it is going to be metabolized in the liver. When it is metabolized in the liver, it is ready to be excreted from the body, and then it is excreted via the urine through the kidneys. So for a better understanding, let's look at the absorption phase. Absorption of the drug depends upon the route of administration. For example, if we have administered drug through the oral route, the drug is going to be absorbed via the gastrointestinal mucosa. If the route is intravenous route, drug is absorbed directly into the blood. If it is intramuscular route, it is absorbed via the muscles. The second phase is the distribution phase. In this phase, the drug is distributed to the tissue where it is going to perform its action, and the distribution is done via the blood. The next step is the metabolism. In the metabolism phase, after the drug has performed its action, it is going to be transferred to the liver where it is going to be metabolized and is made ready for excretion. And in the final and the excretory phase, the drug is excreted via the urine through the kidneys. So that is it about pharmacokinetics and the movement of the drug in the body and its four phases, that are absorption, distribution, metabolism and excretion, ADME.